Hello all, we have got a subscriber asking, is it required to change the silver amalgam filling? Specifically, the question was, I have got a silver filling done many years back. It doesn't look good in my mouth. It's discolored. My teeth is also getting discolored. But otherwise, I don't have a problem. Should I change it? Was his exact question. So now let's look at that in this particular video. Hello all, this is Dr. Arun from Dentistry. Running a dental center in Chennai, Raja Annamalapuram since year 2001. If you have not yet subscribed to our channel Pearls Dentistry, please do subscribe. We've got a whole bunch of videos coming out on dental education and awareness. So if you look at it nowadays, for example, I don't use mercury in my practice at all. It's a mercury-free practice. It's been many decades since I've actually used mercury in my practice. So it's a largely a mercury. It's a completely mercury-free practice. But we do have patients coming in, who have got their silver amalgam fillings done elsewhere many years back. So typically these fillings are more than 20 years old, sometimes even more than 20 years old. So when they come in with such fillings, their question is of course always this: the tooth is discolored, it's black in color, should I change it? Is it okay? My simple answer to this, of course, we'll have a look at the tooth. We'll check how well the integrity of the filling is. If the filling is very solid in place, and the tooth is also it's completely in place, we don't advise them to change the filling, because it's a very safe filling to have. Even though it's a mercury filling, after many years there are not many amount of any residual mercury in that filling, so it's perfectly safe to have the filling. And two is, if these fillings are usually very strong, because they are metallic in nature. It's an alloy of silver. So because they are very strong, so it's very difficult to remove all the filling. When you remove all such huge fillings, the remaining tooth structure is going to be less. And sometimes it's very difficult to replace just with the filling. You might have to do a more like an onlay or an inlay or a crown on the tooth to actually restore the tooth. So unless otherwise it's absolutely required, we don't advise to change the filling. Very rarely for cosmetic concern, when the patient smiles, when the patient speaks, if these silver fillings are unsightly and then they are showing out, and patient has got an aesthetic concern, then we change them for patient's aesthetic needs. Otherwise, for functional reasons, it's not required to change. But sometimes these amalgam fillings over a period of time, because they are very strong fillings, they are bound to, sometimes there are instances of cracks developing on the tooth or in the underlying tooth structure because of the nature of the filling. Or sometimes portion of the filling chips off. In such instances, we advise them to change into a more remove this filling and then change. So it's perfectly safe to have a very old silver amalgam filling, nothing to worry. You need not change them unless and otherwise it's required, either for mostly functional reasons, very rarely aesthetic reasons. I hope you like this video. If you have any questions, please do ask in the comment section below. Until next time, bye bye and thank you. This is Dr. Arun from Pearls Dentistry.